suicide prevention risk assessment is everyone's responsibility. Behavioral health patients. Our hospital treats many behavioral health patients in all services. It is all essential staff's responsibility to know the patient's risk of suicide, know what the plan of keeping them safe is, ensuring the environment is safe as possible, and provide close and careful observation. This education will teach you what your responsibility is. So why? Why are we doing this? So suicide has increased 30% over the past 20 years. Suicides have been increased in the following age groups between 35 and 64 and 15 and 24. There are 65 patients per year who commit suicides in hospitals. The Department of the VA has decreased the inpatient suicide by 82% by determining the patient's suicide risk and making the environment safe. How do they do that? They determine the patient's risk of suicide using a scientifically supported tool. But also, the patients at high risk of suicide are on a one-to-one observation. The environment of the suicidal patient must be free of objects that can be used for self-harm and free of ligature risks, which we'll talk about in just a minute. All staff who come in contact with the patient at risk of suicide must know the patient's level of risk and plan to keep the patient safe. The patient's treatment plan must include goals and interventions that address the patient's suicide risk. All staff must understand and comply with the suicide prevention policy and patient observation policy. All patients at risk of suicide must have a crisis hotline at discharge, and all patients discharged from the psychiatric units must have a safety plan at discharge. A ligature risk is defined as anything which can be used to attach a cord, rope, or other material for purpose of hanging or strangulation. There are many ligature risks in the hospital environment. Some examples are door hinges, picture frames, chair arms, the hinges on the back of doors, anything attached to the wall or to the stud of the wall, sharps containers, the WOWs, the workstations on wheels, the back of the door, the magnetic back of the doors, the attachments on the ceilings, cords from the WOWs or for anything plugged into the wall. For staff that's non-behavioral staff, when arriving to the unit, always check with the patient's nurse or charge nurse to find out about the patient's safety risks. Never leave equipment or supplies unattended. Double check to ensure you leave nothing behind. Never walk out of a unit without ensuring that the patients are not near the exit, and ensure the door is closed behind you. If a patient is arriving to your unit for a test, ask about the patient's risk and plan of keeping him or her safe. Remove or secure any unsafe items in the testing area that can be removed or secured without impacting the patient care. Requirements for housekeeping. Keep your housekeeping cart where you can see it at all times. Do not leave the housekeeping cart unlocked, and never leave any supplies or equipment anywhere on the unit or in the room. For diagnostic imaging areas and clinics, staff must be aware of the patient suicide risk status, told to us by either the observation center or by the nurse. Staff must be aware of the patient safety plan, again, told by the observation center or the nurse. The observation center must accompany the patient. Patient must remain under a one-to-one observation during the test. If it's in areas like CAT scan or MRI, those observation centers are to follow the patient to the rooms, and then we are to keep them either behind our lead-lined glass or behind the magnetic field in order to keep the patient and the observation center safe. The testing area must be cleared of any and all items that can be used for self-harm or harm the staff that can be easily secured. So now that we've talked about what a ligature risk is, what it looks like, the importance of why we need to recognize it, let's look at the following images and see how many we can pick out of the following pictures. So in this image, there should be 12 ligature risks. Please circle the ligature risks on your worksheet that has been accompanied with your email. And here are your answers. So you've got the sink, the dryer or the towel holder, the shower, the arm rails, the sitting area, the towel holders, both above and below. Next would be a trauma room. Find at least 10 ligature risks in this picture. And again, here we go, the shops containers, the TV screen or the monitor, the light, the other monitor, the code cart, the chairs, the stretcher, the picture frame, the third picture. Find 5 ligature risks in this picture. Most of the ligature risks are found at the doors, at the hinges, at both sets, and then on the back where the magnetic attachment is. In the last picture, identify all the unsafe items in this room. And again, we see the unidentified bags, the dryer, the perfume, the keys, the cigarettes, the lighter, the belt, the purse, the unidentified bags. This concludes the suicide training. If you have any questions, please feel free to reach out. Please don't forget to send your answer sheets to both the exam with the multiple choice questions and the picture part of the evaluation to admin, to Stacy, Peter, or to your section head so we can check you off for suicide training. Thank you.